All right, class, we are getting down to the wire. We have today's chapter 20 lecture on urinary and reproductive systems. And then next time we are going to cover chapter 21 and then we are finished for the semester. So don't forget, final exam will be on mastering Wednesday. What is that date? Sorry about that. Next Wednesday, the 6th. Okay, and again, remember, it's on mastering. You will have an X amount of time to complete the exam once you begin. However, I will open it up at 12 a.m. and you'll have until 11:59 to finish that. So you're able to take it at any time on the 6th, and you don't have to worry about our 1 to 3 o'clock time period that we were originally assigned if we were meeting face-to-face. Okay, so again, just to remind you, chapters 16 through 21, the disease unit is going to be 25% of the final. The other 75% will be all of the other chapters, the cumulative part. Okay, so I will, in the next day or so, be getting a review sheet up for the 25% disease unit. And then for the other 75%, go off of your old review sheets, your exams, and things like that. And as you know, there is a ton of material for the final that we've covered in this class. So begin studying now, basically, if you haven't already. Remember, just review your notes, go over things, look through a chapter or two every day, or more if you can, until we get to the final. Okay? So, chapter 20 is our urinary and reproductive systems. And I know a bunch of you guys have had anatomy physiology already, so that's good. We'll start out with the urinary system, and then we'll talk just a little bit about the reproductive system. So the human urinary system consists of 2 kidneys, the ureters, which drain the kidneys, the bladder, which you all know stores the urine, and then the urethra, which takes the urine out of the body. Okay, so one thing that if you haven't had A&P, that maybe you hadn't noticed before, is that the kidneys kind of sit up here underneath the diaphragm. Okay, we have the rib cage and so forth. And so the kidneys are high in the abdominal cavity. Okay, a lot of times people think the kidneys are down here near the bladder, and they're actually not. They're way up high in the abdominal cavity. Okay, one thing you also should notice, and then we'll talk about as well, is that the female urethra is only a couple of inches long, like maybe 2 to perhaps 2 to 2.5 inches long, where the male urethra is a little bit longer, 6 to 7 inches, and it also has a curve in it. And so we'll talk about why that's important as we get into our diseases. Now, your book talks a lot about the urinary system, and we're going to just kind of keep it to the basics here. But urinary catheters or urinary catheter associated urinary tract infections. So urinary catheter associated urinary tract infections are responsible for about, oops, get all my, sorry, got a little crazy with my pen there and it kicked me out of my screen sharing. Okay, let me get this out of the way, The cause of about 1 million cases of urinary tract infections per year. Okay, catheter-associated UTIs are the most common healthcare acquired infection that we have. Okay, so if a patient needs to get a catheter, it's very important for those of you going into nursing to make sure you're using aseptic techniques and you're very careful inserting the catheter. And even if you are, there can still be infections. But catheters can really be a place for biofilms to grow and infections to develop. Okay, so these are also called Foley catheters, and a tube is inserted into the urethra, and then through the urethra into the bladder, and then a little balloon is inflated to kind of hold the urethra or the catheter in place. So please don't ever pull one out. Ouch. And so the catheter then would drain the urine into the bag if the patient was having surgery and was unconscious, or just needing urine collection there. So let's see. What are some bacteria that cause UTIs, or urinary tract infections? Typically what we see causing urinary tract infections are enteric bacteria, or basically gut bacteria, or small intestinal, or I should say intestinal bacteria. Okay, things that come from the intestine, probably coming out through the feces and contaminating the area surrounding the urethra. E. coli is a big one. There's some groups that are called uropathogenic E. coli. Proteus, Pseudomonas, and Klebsiella are some others that are enteric bacteria. And again, these are going to be gram negative. So there's a lot of, and those are just a few. There's many, many different types of bacteria that can cause UTIs. But no matter what type of organism is causing it, you can get basically the same symptoms. Okay, so a lower UTI infection, which is basically the urethra, maybe also the bladder. So some signs and symptoms: cloudy urine with an off smell, lower abdominal cramping and pain, dysuria, which is frequent and urgent urination. Okay, you may have to go every few minutes, and it's like, oh, I gotta go now, and then there's nothing really that comes out. Pyuria, which is pus in the urine, or hematuria, which is blood in the urine. You can find that as well. Upper UTIs would be ureter or kidney infections, and those are going to be more severe. Okay, you may have a fever, nausea, vomiting, severe pain, and that is something that can cause kidney damage. And if you get a kidney infection or upper UTI infection, that's something that definitely needs to be taken care of right away. Most common method for detecting a UTI is doing a urine sample and doing a dipstick test, and there'll be several things that they'll look for, but one thing is going to be white blood cell count. Okay, if it's elevated, there's probably something going on. And then also nitrite, NITRITE levels. If those levels are high, then there's a UTI going on. And it says here also there's a clean catch urine sample. So a lot of times when you go into, or a patient goes into collect a sample, they will give you a disinfectant wipe to wipe the area down, so that way you're not contaminating the sample with external microbes that may accidentally find their way into the collection vessel. Okay, so that's really all I'm going to really say about the urinary system. Most common, thing with the urinary system is going to be the urinary tract infection. Okay, and it's bacterial generally. The reproductive system, just spend a little bit very quickly talking about the reproductive system. Female reproductive organs sit within the pelvis. It consists of the uterus, the ovaries that produce the eggs. The eggs are ovulated and travel from the ovary into the fallopian or uterine tube. And then this lining here called the endometrium is the area that's going to be shed out during menstruation. And then this layer of the uterus is called the myometrium, which is the muscle layer that helps with delivery of the fetus. And then we have the cervix, which is the bottom, kind of like they call it the neck of the uterus, the bottom portion of the uterus, and then the vagina that leads to the outside. We've talked a little bit about before modes of pathogen entry and how the placenta can be a mode of pathogen entry. Like another mode of pathogen entry would be the skin or the mucous membranes or the parenteral root, okay, if you remember those. The placenta, it forms a pretty effective barrier for pathogens. But there are some that can cross. Some pathogens can cross the placenta and enter and infect the fetus that's developing. And there's an acronym that they have so you can remember which organisms cross the placenta, and that is TORCH. And the first one, excuse me, oh, sorry, the T is Toxoplasma gondii. Do you guys remember which one this is? It is a protist, and it's the one found in cat feces, and it's why women should not, that are pregnant, should not handle cat feces, or maybe shouldn't handle cats at all. And then we have another group of quote unquote others, okay? HIV, syphilis, varicella zoster, the chicken pox or shingles virus, Coxsackie and enteroviruses, and the Zika virus. Maybe you've heard of that one. We didn't cover it, but it is the virus that is emerging down in the southern US with mosquitoes that causes the babies to be born with microcephaly or very, very small heads or other birth defects. Rubella is the R, which is the R in the MMR vaccine. Cytomegalovirus and then herpes viruses are the others that can cross the placenta. The male reproductive system, again, sits within the pelvic cavity. It consists of the testes, which produce the sperm. Then the sperm travel into the epididymis where they mature. And then they will travel down through the vas deferens, and become associated with the seminal vesicle, the bulbal urethral gland, and the prostate. The prostate sits down here underneath the bladder. And then the vas deferens ties in with the urethra. Okay, so let me back up. So with the woman, the vaginal canal only is for reproductive purposes. Okay, the urethra in the woman is a separate canal that expels urine. In the man, the urethra has two purposes, one for reproduction and two for expelling urine out of the bladder. Okay, the seminal vesicles, the prostate, and the bulbal urethral gland produce secretions that basically combine with the sperm to produce the semen. Okay, so now that we got the basic anatomy of the reproductive systems down, we're going to jump into sexually transmitted infections. Okay, so STIs used to be called STDs for diseases. Now they're called STIs. And there are many different types of pathogens that can cause STIs. Of course, there's bacteria, viruses, parasites like protozoa, and also fungi can be transmitted that way as well, like yeast infections. Most STIs will produce some sort of lesion or ulcer or some sort of inflammation, okay? And that inflammation then can increase the risk of transmission of HIV, okay? So if you have a lesion or inflammation of mucous membrane or part of the reproductive system, and you are exposed to HIV, you are much more likely to contract the HIV and become infected with HIV than if you were to be exposed with HIV and not have any inflammation or lesions. Okay. And these estimates are kind of all over the board. But the WHO, World Health Organization, estimates that presence of ulcers because of other STIs increase the risks of HIV transmission by women, in women by 10 to 50%, and men up to 300% more likely to get HIV if they are exposed. Okay, so we'll start out looking at some of the viral STIs. And again, this is a very brief survey through this chapter. But the first one is genital herpes, and it's going to be caused by the herpes simplex virus 2, or sometimes called the human herpes virus, HHV2, human herpes virus. Okay, the cold sores or oral herpes is HSV1, type 1, okay? So this virus is known to infect about 1 in 6 people that are in basically reproductive age in the US, which is a lot, and is transmitted through, obviously, sexual contact. But here's something else that you should be aware of, that a person that has an oral inflammation or oral herpes, basically, if they have oral sex with someone else, they can give their cold sore, put the herpes down on the part of their partner. Okay, so they can be transmitted that way. Also, the cold sores that you can get, if you play with it and then you rub your eye, they can actually infect your eye as well, and other parts of the body. It's called ocular herpes. There's also gladiatorium, herpes gladiatorium, where you can get it basically on other parts of the body. Mostly seen in like wrestlers and people with extreme physical contact like that, but the virus can infect other areas as well. And the reverse is true. If a person has genital herpes, someone can get that on their mouth as well. Okay, so the two types of herpes can swap locations depending on your unsafe sex practices. Some signs and symptoms. The virus is going to go into the epithelial cells, or the outer cells of the mucous membrane or the skin, and cause little ulcers or little lesions here about as soon as 3 days after the contact. And they would kind of characterize this as a dewdrop on a rose petal type of lesion. It's very, very red and inflamed. And you have, these are kind of darker pustules, but sometimes they can be more clear type pustules. And notice, you can't exactly tell where this is, but it's not directly on the penis or the vulva area. And so this is on another, I'm guessing this is probably a testicle. And so condoms don't cover all of those areas. Okay, so condoms may not be effective when there are other tissues touching each other during intercourse. Some complications: persistent latent infections. You don't get rid of it. It never goes away. Okay, so just like a cold sore, it will hang out in peripheral nerves, and then you get stress, there's something happens, and the lesions can begin to develop again over and over throughout your lifetime. Again, there's a greater HIV risk. And then also, if it is a pregnant mother, it can be transmitted to an infant during birth. And in these cases, there's a 25% mortality rate for baby. Okay, again, that's why they test women for STDs when they are pregnant, because we don't want that to be transmitted to baby. If mom does have this, there can be a cesarean section done to eliminate that risk, or reduce that risk, I should say. Treatment, again, there's no cure. Acyclovir is an antiviral that can be given to kind of shorten the outbreaks and suppress the flare-ups and kind of prevent some of those flare-ups. But again, it's not a cure, it's kind of a band-aid, if you will. And again, condoms aren't going to provide full protection because it's transmitted through the epithelial cells, not through vaginal or seminal secretions. Okay, I'll let you guys look at that one. Here's a picture of the picture of the virus there. Incubation days 3 to 7. Let you guys take a look at that one. Okay, another virus is HPV, the human papillomavirus, and there's a whole bunch of papillomaviruses, and 40 of those are transmitted sexually. Papillomaviruses, like the well, I guess there's some that are sexual as well, but those are responsible for warts. Okay, not all warts come from sexual contact, but they cause warts, some of them. Okay, HPV is the most common STI across the world, and almost every sexually active person, so if you've had sex with someone that's had sex with someone else, you have probably had HPV in some point in your life. Okay, very common, and most infections are asymptomatic. HPV type 6 and 11 are best known for genital warts, and then 6 and 18 are for those that cause cervical cancers. And I believe the HPV vaccine has a third HPV virus that it protects against, if I remember correctly. So complications of HPV, especially 16 and type 18, is an increased risk of cervical cancer and throat cancer. They believe now, since there has been a dramatic reduction in men that chew tobacco, that I read here or heard not too long ago that the most common cause of throat cancer now is HPV and not tobacco. And so if there's oral sex that occurs with someone that has HPV, that person could develop throat cancer later on. You know, just a note about the HPV vaccine, and I may have talked to you guys about this before. I have a friend that said, you know, I'm not going to have my son get the HPV vaccine because it treats for cervical cancer, and I'm going to tell him, you know, basically like, behave yourself and abstinence is the best thing, and that's great. But I have a family member that waited until she got married to have relations, and her husband, once they got married, anyway, her husband was married before, and his wife ran around on him, and they got a divorce, and he married this family member of mine, and several years later, she developed cervical cancer because likely the ex-wife brought it home to the husband and so forth. And so she made good decisions and still ended up with cervical cancer. Okay. And so, and again, too, just because it's a male doesn't mean that the HPV vaccine can't protect him either, because it will protect him from throat cancer. So that's my little plug there. So definitely check that out. So HPV is usually resolving. There's not really a treatment for it. And so it will clear up on its own within a couple of years for most people. So prevention of HPV would be the vaccine, okay? And then to prevent cancer would be the pap smear cervical screening, okay? Where they go in with a little rubber type brush kind of thing and remove some, basically kind of scrape off some of the cervical cells. If it's normal, they look like that. If they're abnormal, they will do some follow-up, and that would, the abnormal cells there would indicate that there is a possibility that there could be cervical cancer. Okay, so here is, here's an instance where condom use is helpful. Next one, we'll move into the bacterial diseases. And I wanted to point out, there's a couple terms here that I don't have on the slide, but your book points out, is vaginosis versus vaginitis. Okay, I wanted to point those out. Itis is vaginal inflammation. Okay, and that could be due to disease. It could be due to latex. It could be due to many different things. But vaginosis is where you have a microbial imbalance, or there could be even an infection. And vaginosis is basically identified by a foul smell and perhaps a discharge. Okay, so chlamydia is going to be caused by a gram-negative bacteria called Chlamydia trachomatis. And it is another common STI around the world, 1.5 million cases in the US in the year 2015. And you'll notice with a lot of these, most of these cases of bacterial STIs are going to be those in the reproductive ages of basically 15 to 39. Okay, over 40. It's about 4% of the cases. Sort of like HPV, and you'll see a recurring theme here. Chlamydia, about half of men and 3/4 of women are asymptomatic. Okay, so you may not think that a partner has an issue, but even if they're asymptomatic, they could still transmit the disease. Okay, so in men, inflammation of the urethra, urethritis, dysuria, which is the frequent, urgent needing to urinate, burning and itching, testicular swelling or pain, and also a discharge from the penis. In women, could be bleeding or spotting, dysuria, again, a vaginal discharge with odor, vaginal itching and burning, and maybe pelvic pain and fever. And that, again, is if there are signs and symptoms, okay? Most people do not show any. I'm not going to spend a lot of time on the mechanism of disease, but basically the chlamydia bacterial cells will bind to an epithelial cell and basically tell that cell to bring it inside through phagocytosis, and then it will steal that cell's energy in the form of ATP. And then these cells will become reticulate bodies, which is just a phase of their life cycle. They'll start reproducing, and then they'll go back to what's called an elementary body form to spread to the next individual. I'm not going to test you on it, but if you're interested in looking at that, there's a diagram in your textbook about their life cycle. Some complications I just read this. This is funny. Asymptomatic cases can go undetected and lead to complications. What are those complications? Well, the complications in men could be epididymitis, which is inflammation of the epididymis, and then ultimately infertility. And for women, it could be pelvic inflammatory disease, which we'll talk about in a few slides, which ultimately can lead to infertility as well. And then also perinatal exposure, or exposure of the newborn if she is pregnant. Okay, chlamydia, though, luckily is relatively easy to cure with antibiotics. It is one that you can cure. But even with, you know, the viral diseases like HIV, HPV, the herpes viruses, once you get them, you have them forever, okay? With the bacterial ones, yes, there are antibiotics that can treat, and chlamydia is fairly treatable. We'll learn about gonorrhea here in just a moment, and it is very resistant to antimicrobials. So there are drugs that will treat it, but if they'll work or not is kind of a guess. Okay, so gonorrhea is caused by another gram-negative called Neisseria gonorrhoeae. It is an intracellular diplococcus. So they are spheres that come in pairs and they live inside of the host cells. About 400,000 people in the US diagnosed with chlamydia. And I should point out as well, according to the CDC, with a lot of the STIs, many more go unreported. Again, because remember, a lot of them are asymptomatic. And so they tend to think that the actual number of people with the STIs is actually double or more. But it's hard to tell because of the asymptomatic cases. Again, 15 to 39 is going to be most of your cases. Again, gonorrhea is sexually transmitted. Again, most infections are asymptomatic. Men can have inflammation of the prostate and the epididymis, may have a discharge and dysuria. Women may have painful urination, discharge, and spotting or bleeding. And this would be discharge and also some lesions going on here as well. Okay, complications of gonorrhea, like we mentioned with the men, could be infertility because of the inflammation of the, oops, I lied. This causes infertility in men, chlamydia, but so could gonorrhea. But pelvic inflammatory disease is another complication for this disease as well. And we'll, again, we're going to talk about that in a second. So you have to be basically tested to determine if it's chlamydia or gonorrhea because they look very similar based on their signs and symptoms. And any of the bacterial STIs you can get repeatedly. You do not build up immunity because there are many different strains within those species. So treatment, most strains are going to be resistant to penicillin, tetracycline, macrolides, quinolones, sulfonamides, trimethoprim, and cephalosporins. So azithromycin might be used in combination, and we cross our fingers to hope that would work. Okay, so pelvic inflammatory disease. Chlamydia and gonorrhea are the main causes of that. There can also be other anaerobic bacteria and mycoplasma bacteria that can cause this. About 1 million women each year experience PID, and some are asymptomatic. But other women do develop like a fever, inflammation, pain in the pelvis. Salpingitis is inflammation of the uterine or fallopian tubes. And that's what pelvic inflammatory disease causes. And so you can see how this area here is very much inflamed, and that can cause scar tissue. And basically, here the ovary has become inflamed, the endometrius has become inflamed, the uterus itself has become inflamed, and that scar tissue can basically prevent the egg and the sperm from meeting. And if it happens bilaterally, that can result in infertility. And also, even more dangerous is if the sperm can get past the scar tissue and unite with the egg, there could be an ectopic pregnancy that could develop, and that can be life-threatening if that's not diagnosed properly. And abscesses also could develop on the ovaries or the tubes. Complications, we talked about pain, infertility, miscarriages, or ectopic pregnancy. Diagnosed based on tenderness during a pelvic exam, blood work, or MRI, ultrasound, something like that, can be treated with antibiotics. Okay, so syphilis, I think we talked about this earlier in the year as well, how it is a re-emerging disease, as well as gonorrhea. Things we had, a couple of diseases that we had kind of knocked down in terms of number of incidences have turned around and come back on the rise. Let's see. Etiological agent means basically the causative agent. You'd think by now I could write better on this screen, but I can't, so I'm sorry. Treponema pallidum is a gram-negative spirochetes. Remember, spirochetes are, I can't draw either, spiral shape, they're stiff spirals. These you can be reinfected with this as well. Groups at risk, mostly homosexual men here. Women is a smaller group there, and then men who have sex with women. I don't know, you can look at that if you're interested. So if this is untreated, okay, the disease will progress in 3 phases. Okay, the first phase or the first stage is the primary stage, and the characteristic sign there is what's called a chancre. And a chancre is basically a sore at the site of infection, and the bacteria then can invade the central nervous system, and usually about 4 to 6 weeks later, the immune system kind of gets it knocked back. However, it doesn't necessarily always kill all of the bacteria. If some of those bacteria remain, the patient then may enter into the secondary stage about 3 months later or after initial infection. And this will involve a rash, and I'll show you a picture of it here, this disseminated rash, which can be all over the body. And also condylomata lata, which are wart-like lesions on some patients. Okay, swollen lymph nodes, sore throat, patchy hair, muscle aches, fever, just kind of yucky feeling. But again, the immune system will come back and kind of knock it back within about 3 months. And then if the patient still gone untreated, you will enter a latent period that may be a few months to a few years long. And if you enter the tertiary or the third stage, this stage can be fatal. Okay, so if a patient's like, oh man, I got this lesion here, stage 1, and then you're like, well, I'll see what happens with it, and it goes away, like, oh look, I'm doing great. And then they may get into the second stage and be like, man, I just have the flu, I don't know what's going on, and they don't connect the dots. Then they enter into the tertiary stage, And this is where you can get lesions called gumma, which are like rubbery type lesions on the skin, on your bones, on the heart. And those can lead to heart damage and neurological damage, like problems sleeping, vertigo, seizures. Those types of things can be even like 5 to 10 years later after the initial infection. Can cause paralysis, memory problems, hallucinations, and again, could be fatal. And from what I remember, and I wish I would have looked this up ahead of time, from what I remember, the tertiary syphilis is not a treatable stage because it's the immune system causing the damage during this stage. Might look that up. I'm not going to test you on it, but if I remember right, that was what I had remembered. Here's a gumma lesion, and then that secondary stage disseminated rash. It is curable with antibiotics. Again, with all of these, you probably want to treat all of the partners to make sure you don't pass it back around. And here's a picture of the spirochete. Penicillin seems to work very well, as we saw. Okay, and so that finishes up our discussion on the urinary and reproductive systems. Next time, again, we'll finish up with chapter 21, and we are headed for the home stretch. So if you have any questions regarding anything, finishing up the semester, the final, any of the material that we've covered, please reach out to me, and we will talk to you again soon.